Are you worried about sagging cheeks or sagging face? Are you feeling that you are looking a lot older than you feel? Then probably this video would help you. I'm Dr. Ashish Davalbhakta, a board certified aesthetic plastic surgeon, director of Aesthetics Medispa and Advanced Aesthetics, and a past president of the Indian Association of Aesthetic Plastic Surgeons. I'm going to be telling you today in this video a little bit about options in non-surgical facelift. You feel that you need a facelift, but probably you're not yet ready, then this video will help you. Non-surgical facelift is more popular than ever. There are a lot of advances that have happened here, and people are getting good results too. But if the selection of your case is not right, then you may not see much improvement, or it could even be a disaster. So what will work for you? You need to understand. First, let's see what is happening in aging. There is deflation, that means your fat pockets shrink. There is sagging, where gravity then pulls down your tissues. And there is loss of elasticity, as a result of which you get the sag and the wrinkles. We have to work on all these three to actually get a good rejuvenation or restoration of youthfulness. So what will be the first thing? The first thing that works and which is ever popular is botulinum toxin. That is something that you can start on really early because it helps in preventing deterioration of the skin. What does it do? It relaxes the muscles which cause wrinkling of the skin. So your wrinkles disappear. So if you've got forehead lines or you've got frown lines or crow's feet and you're worried about these areas getting older, then botulinum toxin will work for you. The next step is where deflation is starting. And typically deflation is usually periorbital in this area. And you can inject a hyaluronic acid filler fairly safely, extremely popular, and is quite capable of filling in the deflation that you have got. However, where to inject, how much to inject, and where to place it so that you get maximum benefit with least amount of filler all depends on the skill of the physician. And that's why you should seek an aesthetic plastic surgeon at Advanced Aesthetics, where they will be able to guide you and help you with placing the fillers and correcting the deflation or loss of volume that you've had. What do you do if you've got sagging? If your face is now starting to sag down and you've got nasolabial folds, or you've got jowl, or you've got necklines, or your brow has sagged, for these, an option which is now catching hold and becoming popular is thread lifts. So these are absorbable threads, and there are some permanent threads as well, but they have kind of barbs or ratchets in them, which when passed underneath the skin, they anchor onto the tissues and lift them up with the traction. So these threads, when placed strategically, they can correct some of these sagging effects to a certain extent. They are not going to make a huge difference. If you've got quite extreme amount of sagging, they are not going to help. So selecting the right candidate in whom this will work is very important to get a satisfied or a very good result. But these threads, they do develop some scar tissue around them. The threads dissolve and they are replaced with collagen, and it helps in firming up your skin, and that's how they can temporize or delay the sag that is happening. But none of these are as effective or as corrective as the surgical facelift. And you need to know that if you advance to that stage where the slack or the movement of the tissues is quite a bit, then it's only surgical facelift that will help. And for anyone who does need a surgical facelift, if you go for these non-surgical options, they will only give you limited improvement, and you could very well be dissatisfied. So these are options. There are many more non-surgical options like HIFU or monopolar radiofrequency, which helps in stimulating the collagen formation in the skin, and also scar tissue underneath the skin, which helps in tightening and lifting. These options, along with PDNs and exosomes and also peels, these are options which improve the quality of the skin, and these options are also something that you may want to entertain or try. So in conclusion, non-surgical facelifts do have a role, and they can help or work for somebody who is wanting some facial rejuvenation without wanting to undergo a facelift surgery. Then these are the options that you should try. Do give us a call, write to us, drop in for a consultation if you wish to know more. If you have liked this video, do click the like button. If you wish to learn more about facial aesthetic or cosmetic surgical procedures, subscribe to our channel. Thank you.